And I think one of the most fascinating things with this is the using it to detect pneumothoraces. And it's really fast and simple, and I think any paramedic, actually any basic EMT, could master this. And that is to just place this at the second intercostal space, second or third intercostal space, mid-clavicular line, and I've got the probe oriented longitudinally with my body, and what you're seeing now, those black lines are actually shadows from my ribs. And if I turn the probe, they would disappear because I'm kind of now shooting longitudinally in between the margins of the bone.
Mm-hmm.
And while this doesn't mean much to anybody, this image you're viewing is called a B mode. If you then hit the button for M mode, which is a recording of motion, now hang on, I'll show you. What's cool about this is that what you're seeing on the right-hand side is called an M mode of my chest wall and my lung. And this is what you're seeing here, something called the seashore sign. There's my liver on the top, and then my kidney would be off to your right under the liver to the bottom right. I don't know if it's kind of spherical with kind of a white interior.
Mm-hmm.
You can actually see my aorta pulsing. I don't know if you can see the well, here I can get you a better view of the aorta. I'm going to actually measure the diameter of there we go. One second. Anybody who has more than 30 millimeters has an abnormal dilatation.
Mm-hmm.
Let's see. So the good news for me is, can you see the numbers on the right?
I can. Looks like you're at 20 millimeters. That just the numbers are a little fuzzy.
Yeah. So that, fortunately for me, is a normal aortic measurement. But yeah, there's a lot of cool things you can do with this technology that I never knew you could do. Well, and if we could send images like this to the hospital, it'd be amazing.
Besides abnormalities in the chest, like pneumothorax, what could the paramedic look for in the acute setting with an ultrasound?
It's interesting. There are so many things, and I think the most important, I think, after looking for a pneumothorax, would be looking at the patient's hydration status. By looking at their inferior vena cava, you can tell whether there's not enough fluid coming back, priming that pump, or you've got plenty, look for something else as a cause of shock. And I think, you don't want a fluid look at somebody if they've got plenty of fluid come back to their heart and they've got a weak heart. So it's always been a little dangerous to give somebody fluid if you didn't know what their status was. It's very useful if somebody's bleeding into their belly because blood shows up as a very dark, they call it a hypoechoic or an anechoic shade on the ultrasound, and it's very easy to pick up. And while not all fluid in the belly is blood, in the contexts where we would be using this, it almost always is.
Now, here's the $10,000 question. If you were to get on scene with a trauma patient and have this available to you, could this ultrasound imagery be used to better triage a patient to a level 1 trauma center versus a secondary or tertiary trauma center? Or could it be used to verify the decision to call or not to call other resources like air medical service?
So what I think could potentially happen is paramedics embrace this technology and medical directors, develop protocols that allow us to use this wisely. I think this could allow us to do this virtually the same thing, identify patients bleeding into their belly and go directly to the operating room, or go directly to a trauma center if they weren't headed there.
Rather than basing, and I guess the point of me asking the question, Pete, is rather than basing those decisions solely on mechanism of injury, or weighted heavily on mechanism of injury, as seems to be the case many times, this would give us some really objective data to say this patient does need to go to a trauma center, or does not, or potentially does not need to go.
Yeah, I think that the neat thing about this is it's very objective. The images can be captured for review later. I think that not all paramedics are as good with their physical exam skills as they should be. And so trying to pick up a pneumo, I think most paramedics could find a tension pneumothorax, but finding a patient with a 20% or a 30% or a 50% pneumo, I think many paramedics would miss that. And with this tool, they wouldn't be missing those things. I think that would also be true with finding some acute bellies. In some of these studies that I've been reading, some of the paramedics were actually surprised to find blood in a belly, and they didn't think the patient was as sick as they were,